Dr. Jonas Apostol.
Hi guys, so happy vlog anniversary. So this is our first year now. So we started last year lang ng ECQ. So we actually had the time to create a vlog for you to be able to know more about cosmetic dentistry. And I am so happy that we can be able to impart our knowledge and also giving some hope to those who can relate with our cases that we're presenting. So yeah, I'm gonna start with my new case. So this is what I do every day in the clinic, cosmetic and restorative dentistry. So we are dealing with a lot of veneers, crowns, and bridge, sometimes combination. So this is a case of an adult female with a chief complaint of having an asymmetrical smile, as you can see, uneven shapes, and also multiple root canal treated teeth. So this is not a straightforward case. As you can see, the upper right canine is a little bit high, and the premolars are collapsed, and obviously there are problems with the bite and occlusion. So the patient had braces before for a few years. So it ended up like this. Hindi siya satisfied with the aesthetics, not just the appearance but also the alignment of her teeth. Because of some issues, nagkakaroon talaga ng relapse, and she's not happy with the anatomy and morphology of her teeth. That's why we want to create something beautiful that would become an asset, no, sa entire face. So we proceed with the smile design. As you can see here, I use composite material to do direct mock-up, and the collapsed area is now in harmony and in proportion to the other quadrant, and the distribution is fairly good. So we placed a bit whiter shade to make sure that the patient could see the possible outcome of the color and the shape and the design as well. So I use coarse burrs to make sure that we remove all the sound structure swiftly, and as well as I use the finishing burrs to be able to ensure that we don't damage the sound structure and be able to establish the margin. So with the preparation, as you can see, this is a combination of veneers, crowns, 3/4 crown, because for some areas or for some teeth that are still vital, I don't want to remove a lot of sound structure, because saving every healthy structure is very, very important. For the cord, I used 00 or 000 cord from Ultradent with hemostatic gel to make sure that we deflect the gums and be able to establish the margin while stopping the possible bleeding as well. So with the final impression, I always use the two-step technique, no? Putty first and then wash para mas accurate.
1 week later.
So for the high canine, I place a little bit of pink porcelain to make sure that we emulate the gums, no? Para the gingival height should be equally distributed. No, it's just an illusion. And also, for the nuances of the natural structure, we incorporated here like the serrations and translucency. Also, some things to make sure that it would look natural. So try-in is very, very important in this case. No, we have to make sure that what we place in permanently must be approved by the patient. So this is not just about my decision, but also with the patient's approval. And if she's happy with the result, and that's the time that we will cement it permanently. So in this case, I use Emax Porcelain veneers combination with crown, so 3/4 crown. And if there are some modifications, if the patient is not happy with the design, we can actually modify it directly. We have our own laboratory and we can tweak and modify it within a day. So after trying, the patient is happy with the outcome and we cement it permanently within that day. So as you can see here, there are some spaces on the gum area, but it will adapt after a few days or week because we lifted the gums for the cementation process. That is very, very important to make sure that there are no cements, and we should also ensure that there will be no bleeding, saliva coming in the area where we cement the veneers. So we now talk about the results. So the patient is happy with the result. We make sure that it looks natural, and that's the patient request, that it should look maayos na not obvious. So actually we achieved it and she's so happy with the outcome, and I'm so happy as well. If the patient doesn't want to undergo another orthodontic treatment for her case, because the issue here is not just about the crookedness of the teeth, but also the shape and the size, and also the color. So we can only achieve that by doing veneers. So to ensure the functionality of the teeth or the veneers or the ceramics that we placed in, we run it with our T-scan. The T-scan machine is very, very helpful in my career as a cosmetic dentist because we can be able to check the bite force distribution. And also we did cleaning to ensure that there are no any excess cement that could cause any trouble with the gums. Also, night guard is very, very essential to protect the teeth. So every case is different. So I am open with the patient's opinion about the design that she wants for her smile, and also clear communication with the patient is very, very important to me because we want to give what's best for the patient. And there are some limitations though, but I always make sure that it should be an advantage for the patient, not just about the beauty, but about the health and the function. And that's very, very important for the success of any restorative cases. So in every Smile Makeover case, the patient should adapt with the new smile, sets of teeth, because it involves a lot: the musculature, the ligaments, and also the habits. So pag tumatagal, will feel like it's your normal teeth, sets of teeth, which is beautiful. But for some cases, it will take a while for them to be able to feel that it's like their natural teeth. Pero it's part of the game because we change a lot. So it takes time sometimes. Healing could be a little bit longer for others, but for some, in an instant, okay na. So it's always case to case. And that is one of the things with cosmetic dentistry, is that you have to give time for healing and for it to adapt.